Good morning, ladies and gentlemen here in the room, but also good morning to Dario, to you online. Perhaps before we start, can I
Morning.
just check, do you hear and see as well?
Yes, everything is seems perfect. Thank you.
Super great to have you with us as at the panel, but let me perhaps go to that in a minute because I would like to welcome you this morning. My name is Elizabeth Kuiper. I'm Associate Director and Head of the Social Europe and Wellbeing Program here at the European Policy Center. And I'm very happy to welcome you to this event about planetary health and the need for a more holistic vision. And we were just saying that I think if you think about last Sunday, the car-free Sunday in Brussels, this is a very important example to start with that illustrates how human health and planetary health are connected. Because I read this morning, and perhaps the speakers will go into that into more detail, that actually when it comes to air pollution, the rates on one Sunday already dropped down considerably. And I think all of us have learned since COVID-19 that indeed there is a direct link and an intrinsic link between the planet's health and the people living on it. And I think that idea has already been studied for longer. I think the term and the concept of planetary health and One Health sometimes have been used in the past, and the concepts are still being studied, and we're going to into that in more detail later on today. But I think that idea that long-term human health and planetary health are interconnected and need to be approached that way, I think is quite clear and is being recognized as we speak. However, while the need for a more holistic approach is indeed apparent, the policy challenges that come with it are much more difficult to tackle, and the path to achieving this more holistic approach is not always clear. And perhaps for the sake of discussion, because we also have the European Commission around the table, I was wondering that given the fact that in last week's State of the Union, the planetary health or the One Health approach, because I think that's the term that the Commission prefers to use, didn't really figure in the State of the Union. And given the fact that actually Commission President von der Leyen was the president that started her mandate with the challenges of COVID-19, that showed the intersection between planetary health, human health, and animal health. So I was wondering, and again, a question for discussion, whether that was telling and whether that indeed shows you and illustrates the challenges that we have ahead of us. So with that in mind, the European Policy Center, together with our partner Sitra, started working on a project indeed was aiming to identify the challenges, opportunities, and policy actions that are needed to ensure a more effective implementation of the planetary health approach. So this in-person dialogue this morning will indeed go into the dialogue. I hope indeed that we have an interactive exchange also with you as the audience and with the speakers, because we have excellent speakers indeed from the side of the European Commission, from Sitra, from the European Public Health Alliance. I'm very happy that I have my colleague Danielle, who will start with pointing out the main findings of the study. And I really hope and look forward, and Dario, of course, I mean, I already welcomed you, but let me also welcome you as one of the speakers. It's great to have you. And we have you in the past. I'm sure that indeed you will bring up some points for discussion as well. So Danielle, let me start with you and give you the floor to present the findings of the study.
Thank you very much, Elizabeth. As Elizabeth mentioned, there calls for a more holistic approach have been recognised for some time now. I think the era of permacrisis has really shone a light and underscored the need for a more holistic approach, and indeed the intersection between policy areas, particularly environmental policy and health policy as well. We've seen with the pandemic for one, and also the climate crisis really underscores the links. I think yesterday heads of governments met in New York in the context of the UN General Assembly, and they discussed how the climate crisis is actually unequivocally also a health crisis. So discussions like this are very important for bringing planetary health into focus, and also that we can really prioritise the climate crisis, but also to see it as a health crisis. Of course, our planet and our environment has both negative and positive implications for public health. High quality natural environments are linked to lower rates of cardiovascular disease, improved pregnancy outcomes, and reduced mortality rates. And natural surroundings can also have a positive impact on mental health and well-being. However, the flip of that is, given the state of our planet and our environment, 1 in 10 premature deaths in Europe are linked to pollution. environmental and occupational risks account for approximately 10% of all cancer cases, and the rise in temperatures correlates with the rise in rates of infections, allergies, and water and foodborne disease. So there's an evident link, and I don't think anyone is going to deny that link, and the need for a more holistic approach and joined up thinking is definitely needed. However, it's not without challenges, and it's not an easy thing to do. So in our paper, we firstly began by highlighting some of these challenges, and we've identified these as being organizational structures, which often lead to siloed policymaking, and this occurs at various levels of governance. It's difficult to break these silos. I think silo breaking is something we discuss a lot, not just in relation to planetary health, but in relation to different policy areas. But it's not necessarily an easy thing. These things tend to be institutionalized, traditional way of doing things. So it's definitely a challenge when it comes to implementing or indeed advocating for a more planetary health approach. In relation to this as well, acquiring buy-in from a diverse range of stakeholders. In order to implement a planetary health approach, it involves a lot of actors, a lot of stakeholders, both at the governmental and policy-making area, but also on the ground, various sectors working together. And this can be difficult, particularly when we are in this era of permacrisis. There are a lot of diverging priorities. There's a lot going on in the world. And so acquiring buy-in from all of these sectors can also be a challenge. Along with resource mobilization, can be constrained by limiting funding and again, by competing priorities. Demonstrating the impact of planetary health is a challenge we also identified. There are not necessarily defined indicators that everyone follows when trying to adopt such an approach, and also may not align with short-term economic metrics, particularly in our current model that was most common, I suppose, in European countries. It fits perhaps better into different economic models, such as one of a well-being economy. Further challenges that we identified are data silos, education and skills gaps, and also research and funding structures that need to support interdisciplinary approaches perhaps a little bit better. So in order to try and overcome some of these challenges, we set out a couple of recommendations. And the first is to work towards breaking down silos at all levels of governance to really promote a planetary health in all policies approach, and to encourage cooperation between various stakeholders, including government bodies, civil societies, academia, and business. And at the European level, one recommendation that we have is perhaps appoint an executive vice president for the wellbeing economy. It's something that we've been kind of talking about here at the EPC for quite a time, and the idea would be to appoint a leader who'd be responsible for overseeing the integration of a planetary health approach across the relevant directorates at the EU level. And we also have recommended that we look towards common indicators to try and measure the impact of planetary health, which will also help to advocate for it and to acquire buy-in from the actors that will require buy-in. Other recommendations are best practices platforms. We have seen in various parts of Europe that there are actually good practices when it comes to planetary health. And by creating a platform and sharing these, we can work at sharing at the different levels. For example, some of these are occurring at a very local level now, but there's much opportunity to scale these up at regional, national, and even European level. So it's about creating that knowledge exchange between the relevant bodies. And as much as the environment will help health and public health, and in turn should help health systems can also play a very important role. And this is something that we've also recommended, that health systems themselves adopt a planetary health approach. So looking at things like green procurement, even as well advocating for nature-based interventions, to strive towards a more planetary health approach for health systems. And of course, education and communication will play a massive role as well. We need to work with actors. For example, healthcare professionals can play a really big role in pushing towards a planetary health approach. They're the people that speak to patients and have a great line of communication there. However, with that said, they need to be equipped with the correct knowledge and skills. We're also working in the context of a health workforce that is across Europe overburdened and overworked. So we do need to make sure that you're not adding to their burden, but in fact providing them with the correct knowledge and skills to only enhance what they're doing. So I'll leave it at that for now, but I'm very much looking forward to hearing from the rest of the panelists for their remarks and interventions.
Well, many thanks, Danielle. That's very important input indeed for the discussion that we're going to have. So let me introduce our panelists. And let me start with Rosa, Domenech, Amado. Rosa, you're now Director One Health in DG SANTE. So I think you're very, very well placed indeed to be the first in this panel to comment on the paper. And I know that we have prepared several questions, but I would like to ask each of you to shortly comment on the questions so that indeed also we have some room for discussion also between us, but also potentially with you in the room. So Rosa, indeed, my first question would be, and again, it's a very open question, and I think taking into account that the challenges that Danielle just pointed out, what do you feel and what do you think are the priorities of the European Commission based on this paper, but certainly also what are the challenges also perhaps of the governance of the European Commission?
Well, thank you. Thank you very much for inviting me, and thank you for the paper, and congratulations. I mean, clearly we can't but agree with the diagnosis and also with the challenges identified in the paper. As I told you before, I for several reasons I had to prepare this very quickly yesterday. I would start with the reason why my directorate was created, and actually it was already to give a sort of a symbolic sign of where policy should go. And it had already two immediate sort of effects. One was inside DG SANTE. I don't know if you know DG SANTE, it's called health and food safety. And we used to have health on one pillar and another pillar was food safety. Now we no longer talk about pillars. The word pillar is forbidden in our DG. Everything is one health. The other element is in my own directorate. There's one policy unit dealing with AMR and nutrition, both of them very much One Health policies, but at the same time, the other teams are all about coordination and about consistency of message and coordination, interinstitutional, etc. We're also we have started internal discussions on One Health since more than 1 year. You can imagine it's not only DG SANTE, it's RTD, it's Clima, it's Agri. I mean, we are talking with all the DGs, and we have actually ask, I don't know if you're familiar with the scientific advice mechanism, which is a sort of advisory body to the Commission, also to come up with an opinion precisely with the idea to see how to operationalize, if this word even it's horrible, and I can talk about this a bit later, at EU level and Commission level, how we can do this, as Danielle was saying, since this is one of the main challenges. And this is particularly important because we are already starting to prepare the next Commission mandate, and that's a bit our objective. And in that context, for me, one clear idea and one focus that our policy needs to really to focus on is prevention. Our policy has been systematically focused on cure, on solutions. We really need to go for prevention, and One Health is clearly about prevention. I'm not going to go into the different aspects of and I can go afterwards in terms of coordination of funding. Maybe a couple of words on challenges and also linked to what Danielle was saying. Well, first of all, while we are used to inter-service coordination, consultation, everything, One Health absolutely needs a change of mindset in the way we work. It is not only about coordination. I mean, really, we need to work in another way. And you were making the reference of a vice president, or we, as you know, we already have executive vice presidents. And while obviously they've been useful to ensure a sort of consistency among transversal policies, I think we are way far away from real One Health. So that we will need to really to put a bit more energy on that. We have some examples, and I will come back to that later on. I will maybe make another reference to something that Danielle said. You were talking about a European-wide communication campaign. In the Commission, you do that when you really have a clear political priority on that. So, and I come to my main point, which is we absolutely need to have this as a political priority, and for that we need to have political will. And Elizabeth, you referred to President von der Leyen's last State of the Union speech, and of course she referred to the green transition. But we are also now in a pre-electoral or almost electoral campaign, and you've also seen the position of a number of parties, in particular the EPP, in one of the key transversal initiatives, the Green Deal. So allow me to also to be, or at least to call for a bit of a realism in terms of how we approach planetary health or One Health. For us, it's true, we refer to One Health, but basically for me, it's broadly the same. And that's why I think it is also important that we advance on specific issues. You are talking about coordination. We are now experiencing in the Commission, you've all heard about the outbreaks of avian influenza, for example. We are, what we don't want is an outbreak in a farm to end up as a pandemic. Huh? And we've had the experience before. So we're working really very cross-cuttingly to do that. You are talking about the quality of the data, and we are in the middle of discussions on the European health data space. Hopefully this will succeed. But we also have the observatory, the European Climate and Health Observatory, which also goes into the data and warns when there are signs that would require action. Last but not least, true at international level, and you were referring to UNGA this week. As we speak, my Director-General, my Commissioner, could not attend, unfortunately, but my Director-General is precisely attending, well, not now, they are sleeping, I think, but in a few hours in many events, pushing really for the idea of One Health. And as you know, we are fiercely trying to negotiate the pandemic agreement that ideally should be adopted next year, whose base should be really One Health. And I'll stop here and maybe come back later with other elements.
Well, thank you so much for that, Anita. I think these are very important opening remarks, and especially what you said about the political will of member states. I think indeed all of us working on health policy and the interlinkage between health and environmental policy, I think, are very well aware of the national dimension. In that respect, I'm sure that we're coming back to the dimension later on. And I also indeed have a follow-up question to you about how the Commission is dealing with that conundrum, actually. But let me first go to you, Cale Lawlor, Senior Policy Manager at the European Public Health Alliance. I think the Public Health Alliance indeed has been very outspoken and very committed to the need for a more holistic approach, call it indeed a planetary health approach or a One Health approach. So, Cale, I'm also looking from a public health perspective to your reflections on the paper and the challenges that you still see.
Great. Thank you for that introduction. I'd like to think we try. And thank you very much for having me here and having this paper out there. It's really great to see the momentum sort of building around this and planetary health as a concept and as a holistic kind of plan of how we can all move forward. So I've read through the paper, it's really great. And I really like so much of what's identified in there. I think the priority that it comes out in the paper, and the priority for all of us, is to get this widespread buy-in, which I think is kind of what we're all talking about in one way or another, to get this social buy-in from everyone, of knowing that this is something that needs to happen, and something that needs to happen for everyone's health and well-being, to have a planetary system that works, really, to have a health system that works, to have a society that works. So we need to establish this as a strong, cohesive concept, and to sell it, and to get buy-in, and to make people, well, to have people feel and know that this is how health works. Because say in the 19th century, people didn't know about water pollution and infectious disease, and then we had John Snow, who proved, very clearly that cholera was linked to polluted water, and now we all take it for granted that water pollution causes infectious disease. So what we need to do is now shift that, build on that, because we know so much more about health and planetary science and everything now. We need to shift that to say an unhealthy planet, a polluted planet, equals bad health as well, because it's the same thing on a bigger scale, really. So we need to sell this as an idea, and to make people know about it. I think part of the way we do that is by highlighting co-benefits. My work would be doing that in health co-benefits, but we can do that for so many things, really. There's economic benefits, there's agricultural benefits, there's all sorts of benefits, really. I think the climate change is, people for the broad part now believe in climate change, but we need to sell this in the same kind of way that we sold climate change, and to highlight how tackling climate change will benefit all of us, because that is still something that I think not everyone links necessarily. I was in Bonn last year at a WHO workshop, and no slide on the WHO, but they're just now kind of talking about building up the evidence around non-communicable disease and climate change. This should have kind of been happening 20 years ago or so. So, people maybe think that this is a lot further advanced than it is, but we're still needing to build up this evidence and the data that we're talking about here. And so climate change, we need to highlight how we really need to push how that affects health and well-being, but also other things such as, pollution and pollination, and biodiversity, as you've identified. If we're impacting biodiversity, if we're slashing land and putting humans closer to animals, we get a pandemic risk, and we all don't need to know again about how awful that is. But also, if we destroy all the pollinators, if we destroy all the biodiversity, we're going to collapse the food system. So we need to make these things quite clear, because everyone cares about food systems. Maybe not everyone cares about the status of bees or about a concept of planetary health, but everyone cares about food. So we need to really highlight and push all these things to get all this buy-in. And then, speaking of air pollution, which is one of my favorites, I think with air pollution as well, we need to really highlight this and highlight how it affects all these other systems as well, because I don't think generally people know necessarily about how toxic air pollution is, and how toxic it is not just on humans, but biodiversity, agriculture, infrastructure. I went through a medical degree and 2 public health degrees, and I still had to do specific learning to know about the health problems of air pollution. It's not something that's taught in health or medical schools necessarily. So how can we expect the average person to know about the risks of air pollution? And I think with that, we need to promote health co-benefits, but also economic co-benefits, because again, people care about economy. With the Ambient Air Quality Directive, full alignment or half alignment by the EU will produce between 6, 7, and 12 times the economic benefit that it will, the investment. So having figures like that, I think, is incredibly important. I read another study the other day that said that the benefit for air pollution, morbidity, and mortality would pay off climate change mitigation. So we mitigate climate change, we'll get more benefit just by the decreasing of air pollution. And those kind of figures are just so incredible, because people think, dealing with air pollution, dealing with climate change, it's going to cost a whole heap of money. It's not actually, it's an investment. I think having these things is, selling them in this sort of way, they're beneficial, they impact everyone, and they're an investment, I think is key to it. And then we also, with this, we probably need to kind of shift our paradigms a bit more. As you've said, degrowth, we don't need to see growth as the sole the sole output of everything, and focus on the economy of well-being. But we can talk about that maybe more in a little bit. I'm sure it'll come up more.
Well, thank you so much, Cale. I think there's indeed a lot in what you said and needs requires further discussion. I think what you said about the need for communication, clearly that also came back, I think, in what you said, Rosa, and the challenges there sometimes are at EU level, but also indeed the case for more evidence. I think that's a very important one, because if indeed after the education that you went through, it's still hard to get to that level of education, let alone for the average citizen. So clearly a lot of food for further discussion there. But let me now turn to Dario. Dario, you have also been involved in the roundtables that we organized prior to the publication of this report. And I was struck by the fact that, Cale, you used the word buy-in. And actually, that was the question I had in mind to ask you, because clearly in your position as expert at environment, human health and well-being at the European Environment Agency, you are used to work with multiple actors. So speaking about the challenges of getting a more holistic approach, what action is required, in your opinion, to get more buy-in from different stakeholders?
Thank you, Elizabeth, and thanks for the speakers before me for their reflections. So let me start with I would say one introductory reflection about this, which is I say this not necessarily as under my hat at the European Environment Agency, but also in relation, I guess, to my background as a researcher as well and consultant, also on issues related to political science and international relations, which is that leadership and political will are necessary in order to transition an issue to or an approach to the highest level of politics, particularly when there are windows of opportunity, such as following the COVID pandemic. So this is a window of opportunity really to try to achieve that buy-in that you were discussing about. So achieving that buy-in depends critically on presenting this overarching and ambitious vision, in this case of planetary health, as a political priority for sure. And I think we have an excellent example with what has happened with the European Green Deal and some of its associated strategies. I think the narrative around some of the policy proposals under Farm to Fork, under the biodiversity strategy, under the Zero Pollution Action Plan, really try to bring the two lines of evidence together about the impacts on the environment and the impacts on human health, whether in the impact assessment, whether in when making the case for the policy proposals to be adopted, and I think clearly doing so is fundamental in making the case for planetary health, particularly because human health is something that appeals particularly to different constituencies that may not necessarily be engaged otherwise in issues related to environmental sustainability. Just as an anecdote, I mean, the products that the European Environment Agency works on that have to do with human health, whether it's air pollution, whether it's chemicals, whether it's bathing water quality, are by far the products that have the widest reach among our products. And this, it's in itself kind of an explanation, I guess, of why we should insist on bringing these two lines of evidence and communication together. Also related to how you communicate the issue as a way of getting buy-in, it's the issue of cost that Cale also mentioned. I think we're all familiar with the World Bank graph from a few years ago showing the cumulative costs of acting too late when a health emergency strikes, a One Health emergency, let's say. And this has been updated recently also in a Lancet paper that was part of the One Health Commission that brought in also the environment aspect, so the deep prevention aspect of acting even earlier on in the chain. And we should do much better, I think, at highlighting the cost issue and how acting earlier helps reduces costs of health emergencies, including prevention. So including at the level of environmental protection as a way of preventing issues of food security in the future, climate change impacts on health, and so on and so forth. So I think assessing and communicating the costs that we will face with delayed action is critical also for this buy-in. And I worked recently at the European Environment Agency particularly on the pesticide files, also together with DG SANTE, by the way, on the sustainable use regulation. And I think I was quite pleased to see this, the update, let's say, to the impact assessment that DG SANTE presented assessing the impacts of reduced pesticide use on food security. And that was an excellent example of making the case for, better outcomes from the environment means actually better outcome in terms of health, not only in terms of direct health impacts, but also in terms of the broader consideration of ecosystem services, including food security. Then, Cale, this was also something that Cale referred to. The final point about buy-in that I wanted to make is that, of course, to do so, you need to show the evidence, and I think this is how this is where the role of the agencies also comes in, and it's quite important. Of course, on the one hand, showing the evidence means how we present the evidence and impact assessments on new policy proposals in the language of policy proposals themselves, showing that One Health or planetary health really need to be an organizing and drafting principle. But with respect to the role of the agencies, I think we really need, and this is what we're trying to do, by the way, with the task force that you also referred to in the paper, is really to show how a One Health collaboration can work in practice to bring together the data sets, the information, also the different approaches and cultures in a way of the different agencies together, showing that we can achieve that transdisciplinary collaboration in providing scientific advice and also in communicating scientific advice and risk. And this possibly, will have this impact also at the policy level into how policy proposals are presented, how they are argued for, and possibly in the public debate around those policy proposals as well.
Thank you so much, Dario, for these remarks. In that respect, I think it's good to see indeed that there's quite some alignment among the speakers when indeed it comes to the cost. And I'm sure that we're going to come back to it because it's clearly something that we saw with COVID-19 as well. As soon as the pandemic was also seen as having an economic downside, I think that made a case for also a public health approach to it. So very helpful there, your remarks. And Elina, let me now turn to you. Elina Drakvik from Sitra, the Finnish Innovation Fund and the project partner that we worked with to come to this paper. Elina, I know that also Sitra has worked a lot on health data and indeed also the European health data space, as Rosa mentioned before. So I want to ask you about data silos, because we have been speaking indeed about silos. Well, the Commission has forbidden the word pillars, but still I think silos do exist. And especially when it comes to data silos and evidence, I think these are a barrier to the implementation of the planetary health concept and approach. So why, in your opinion, is data important and what can be done to overcome these silos?
Thank you very much for inviting me here, but also for the speakers for excellent comments already made. I think I agree with Rosa about the prevention aspect that you brought. And thank you for also lifting the European health data space and also for Dario for bringing, how do we bring the concrete data sets together and make added value out of that. So that is the key question that I will be also addressing. But data is, of course, very crucial when we are trying to measure if we are making any progress or if we are going in the opposite direction, like it seems at the moment. We know that we have already crossed 6 out of the 9 planetary boundaries. So clearly we need to be doing something very differently. And of course, data is in a key position to show this development, and we have to make this transparent and also transparent for the general public, but also for the policymakers, because this can also then enable motivating the change towards better direction. But I think the data also provide us very new opportunities. It will enable new solutions, novel innovations. It will bring science forward. I'm excited for this EU's data strategy that came out already in 2020, and it aims to create a single market for data. It aims to ensure free flow of data between the sectors, but also between the countries. So why is this relevant? Because it also has these different sectoral data spaces, health being one of them. And this is currently being developed and also negotiated. But also there's a data space for agriculture, which is very relevant when we are talking about food production and the pesticide use and the different exposures. There's one on energy, which is also very much linked to the air pollution and what could be done there with the data. And there's, of course, also one on Green Deal that is in crucial role when we are talking about health and environmental health particularly. So there are huge opportunities, but what we need more is that we need more concrete examples, more concrete case studies, how to bring these data sets together, how to make added value, and how to make it possible in a concrete level, but also a clear vision for the future, how this could work for the benefit of the planet and the people and the animals.
Well, thank you very much, Elina. I think that that's very important indeed, and also bringing the European health data space into the context of indeed the broader approaches that are indeed existing, also when it comes to agriculture, food production, Green Deal. I think that's a very important notion also to build on. So thanks a lot for that. Danielle, I would like to turn to you as the author of the paper, because we spoke a lot about building public knowledge, about communication. And I'm sure that when you researched the paper and also when we had roundtables leading to this paper, you went into more about what is needed to create that broader and that a more in-depth understanding and how to build public knowledge. So can you say a few words about that?
Yeah, of course. I think, as Cale mentioned, there is a knowledge gap when it comes to planetary health and why we need it. And if the example is giving that a medical professional, who's gone through years and years of training in the field of medicine, is still not equipped with the knowledge and skills, how can we assume that anyone of the general public will have this knowledge and understanding of the connection? I think people will know that the environment is connected to their health, but the extent of it, I don't think is known. And when we talk about political will obviously is very important, and without it, we won't advance in any of this area. But also, if there's a lack of understanding from the public, then there won't be a push from public, from organizations, etc., to have that political will, and that desire then at the political level will not be there. So it's almost a chicken and hen question, I suppose, in one regard. The point is, we need political will, but we also, if we educate people at the public level as well, that might also work to enhance political will, to give a reason for having political buy-in. At the end of the day, elections need to be won, and if this is a reason, and people wish for it to be, then it can be one way to maybe advance it.
Thanks very much for that, Danielle. I'm looking in the room. I think we have quite an intimate setting this morning, so really feel free if you have any comments or questions. Is there anything that you would like to bring up at this point? If not, feel free to reflect on any potential comments that you may have later on. But let me then continue, because I was very intrigued by, of course, the notion of political will that at the European Policy Center we have been writing a lot about as being very critical for health policy. But at some point, I think, Rosa, you brought up the notion of prevention. And I've been working as a political advisor to the Minister of Health at national level. And I know that already at national level, prevention is not easy, because it's I think, almost ideological. I remember in the time when I worked, and I was back in the Netherlands, that we had a lot of comments about, well, you're basically creating a nanny state if you're going to invest money in prevention, and there's more important urgencies to work on. So you have the long-term care sector, which again, I think in the current context, also with an aging population, still is perhaps an argument to make. So in that respect, and also from a European perspective, where there's also then limited competences, because what can the European Commission do when it comes to prevention? So can you say a few words, because I'm sure that also leading to the creation of the One Health Directorate, you had that discussion in the Commission.
Yes, thank you very much. That was definitely one of the lessons learned from the pandemic, and how the whole thing developed. And as you know, at the beginning, it was, well, throughout it was chaotic. But one of the things that we saw is, I think that prevention is around 3% of the whole spending in the of public spending in health. Obviously, some member states are maybe put a bit more than others. Again, there's a lot of diversity between among member states. And you mentioned it. Unfortunately, health is a very limited competence at EU level. Article 168 in the treaty does not allow us to, like, contrary to food safety or to other areas where we legislate a lot, obviously our action is limited. But you will remember that in 2020 we proposed the European Health Union with several legislation, including cross-border, where we could cross-border health threats, which allows a much more stronger coordination, and the Health Security Committee, which puts together all the member states in not only in crisis situation, but in pre-crisis or even now. I was referring to avian influenza some minutes ago. We are precisely putting a lot of pressure on these prevention elements, but also the understanding, because you know we've had the reaction even in our own house, veterinarians saying, well, you know, but that's a problem, you know, it's just a animal problem. Well, it's not an animal problem. And why has it become an animal problem? Because then is where you see that climate change has that enormous impact on movement of animals, on zoonosis, and then why not on the transmission of these zoonosis to humans. So much more coordination, much more peer pressure, if I would say, also among member states themselves. We also know that some member states are a bit more reticent to be coordinated. And then we have another strong tool, which is funding, obviously. I'm not getting into that research funding because apart from the fact that it's not my specific area, but you know about it and it's huge. But the health program, one of the consequences of the pandemic was that it went from 400 million to more than 5 billion. And a lot of it is on prevention in many areas, communicable and non-communicable diseases. Obviously a lot on cancer for other reasons. And there we are funding a lot of actions to support member states to fill the gap where it doesn't exist. We have joint actions with some member states very much involved. In AMR, for example, in antimicrobial resistance, we have a 50 million joint action to push for a lot of the actions that we also promoted, and it was adopted with a council recommendation in last June. And last but not least, we also, and you were talking about the platforms, and platforms is, we have the health policy platform, which we are, and it works. It works because it puts together stakeholders, member states, and again, but it's a slow process. I mean, when we were talking, I was thinking, obviously, climate change. How long has climate change taken to be sort of put in the minds of everyone? And still, a lot of, public representatives, if we may call them like that this way, are denying. So I think that we need to insist a lot. We need to put a lot of pressure at all levels, and we need to have a lot of patience, because it's not going to happen in a few years. It's going to happen very gradually. There will be new pandemics, unfortunately, and probably the next one will be the sort of defining one, where people will say, well, now we really, really need to take this seriously. But in the meantime, action is there.
Yeah, I think, actions are there. And luckily we have some positive examples as well, because Elina, also on that notion of how to deal with the challenge of prevention in member state, and also perhaps how to ensure that, let's say, practical examples happening at national level. And Danielle, in the paper provides the example of the city of Lati, if I pronounce it correctly, that has a planetary health plan and the first planetary health physician. So in your opinion, how can these, let's say, best practices, which I believe is a very European term, but how can these examples be scaled up so that indeed other member states learn from it as well?
Thank you. That's an excellent question. How do we scale up? But first of all, I think it's crucial that we share these examples, we disseminate them, we bring these best practices and learnings out of there. And for that, we need some kind of centralized platform that everybody knows where to find this information, because now it's very scattered. But let me just first tell you a little bit more about this Nature Step to Health program that runs in Lahti region in Finland. So the program was motivated by these major interconnected challenges. We have the rising prevalence of NCDs. We have asthma, diabetes, obesity, depression being major concerns. We have accelerating biodiversity loss and also climate crisis. And we need to be dealing with all of these and at the same time. And also we want to bring economic benefits out of this equation. So it's a mission impossible, but it can be done. So the program in Lahti, it has 4 focus areas. One of them is having healthy nutrition. It's more plant-based, but it doesn't need to be all plant-based. It's promoting physical activity, how to organize the mobility at the regional level so that it also promotes physical activity. And public transportation. It also promotes living in healthy environments, so paying attention to the air pollution levels, how do we organize the energy issues and so forth. And also promoting exposure and connection to nature. So we think that because of the urbanization, and research has actually shown this, that because of urbanization, our microbiome is getting less diverse. It is getting poorer and poorer. So our immune system is not functioning properly. So we think that by boosting this contact with the nature, we are also training our immune system to function normally. And this has impact to many of the NCDs. So what often motivates decision makers is this economic savings potential. So we have actually learnings from the Finnish asthma and allergy program that ran in 2008 to 2018. And there was an initial investment of 200 million euros, but the savings within this 10 and 11 years of time was 1.2 billion euros. So it was very worthwhile investment for the prevention. And there are studies, peer-reviewed studies that actually show these numbers. And now we are planning in Finland to make this concept broader, also to replicate it in other areas. So there is another area in Finland now that is interested about this concept. And there has been estimation of the costs with the asthma, diabetes, obesity, and depression, that they are about 6 billion a year in Finland. And by implementing this approach that has been implemented in Lahti, there could be a yearly savings of 500 million euros a year. And these are very rough estimates. They are preliminary numbers, but now in Sitra, we are launching a study where we will look at these numbers more accurately and also have more robust scientific evidence behind these numbers. So these can be then replicated and given as sort of key learnings and what kind of initial investments are needed, but what kind of actual real true savings you can get out of this approach.
Well, thanks, Elina, for making that very compelling case, because I would say and I would argue that that is exactly the kind of data that we need to also make that, let's say, public case that we spoke about earlier. So Dario, let me now turn to you, because I know that at some point the One Health cross-agency task force got established. And the audience may have heard about it, but can you say a few words about what the One Health cross-agency task force tries to establish? And also when it comes to prevention and the evidence that Elina just talked about, is there anything that indeed explicitly the task force aims to do?
Well, thank you very much for the question. I was actually about to raise my hand and say something about prevention myself, because I think one of the big advantages of and I'll start then from here. Then one of the, I think, the big advantages that we have in terms of, you know, when we try to adopt and communicate a One Health or planetary health approach is precisely that the notion of prevention becomes something much bigger and more compelling than the notion of health prevention when looked at it from just a human health perspective, right? So we bring in all those sectors that are involved in prevention, seen in this broader context, right? Because then a lot of what we do in the context of the environment is about health prevention ultimately. Whether we, you know, think about recent, again, zero pollution policy proposals, the deforestation free supply chain law is a health prevention instrument insofar as it aims to limit land use change in third countries that may lead to the emergence of disease. In climate change adaptation and mitigation is health prevention. And passing this, you know, making sure that this principle is kind of more widely understood, I think it is fundamental because it really helps us communicate the idea of breaking down silos and bringing sectors together. So making sure that we understand that when we want to improve health, it's not only about DG SANTE, for example, at the European level, but it's about the involvement of DG Agri, it's about the involvement of DG ENV, it's about our trade policy and so on and so forth. In this context, and this brings me back to the issue of the agencies. I think what is really important is that as agencies we have different mandates, and I think our contribution as the European Environment Agency is that we have that attention in our work to systems and drivers and sectors, and I think if we bring that together with the expertise in risk assessment and in risk communication that more of that, let's say, the regulatory science agencies have that we don't have, ECDC and EFSA, then it's a truly unique set of skills that we can bring together. It helps us bridge the gap in a way. And I think, you know, as an agency, I think we recognize that one of the main contributions that we have to the task force is precisely to bring in the focus on systems, on drivers, the information also about contaminants in the environment, about drivers of ill health coming from the environment. And I guess that's where our contribution to prevention is. More broadly about the task force, you mentioned that indeed this was established. It's been quite some time that we've been working on this. Now we are meeting regularly as a task force together with the other agencies. We have essentially 4 lines of action that we're working on. And one is ensuring strategic coordination among the agencies in terms of how we provide scientific advice and policy support. So that has to do, of course, with having a clear strategy for, you know, informing each other about each other's activities, coordinating whenever inputs in terms of data sharing or in terms of, you know, coordinating messaging is necessary. We have a line of work on joint activities and procurement. So moving on from strategic coordination to actually doing things together from the get-go, sometimes even, again, with joint procurement actions when needed, when, of course, the generation of new data and knowledge can benefit more than one agency in this One Health context. We have a line of work in being, let's say, coordinated in our engagement with stakeholders, both, you know, within the EU and outside of the EU. I think ensuring that we communicate in a coordinated way about food safety, about environmental sustainability, about disease control, and that links to the issue of buy-in. I think, you know, communicating with these different sectors that are maybe different constituencies for the different agencies is quite helpful. And finally, we will try to work a lot on research coordination, trying to make sure that we interact with the research community, with Horizon Europe projects and programs in a way that signals, on the one hand, of course, the knowledge gaps that need to be filled by this project, but also the importance of the different Horizon Europe projects collaborating with each others, making sure that, you know, if we have a One Health partnership on animal health and welfare and a One Health partnership on food systems and one on AMR, they're able to talk to each other, share knowledge, because that's also One Health, not only at the policy level, but also at the research and knowledge production level.
Thanks, Dario. And I'm looking into the room. Is there any comment, any question from your side? Because if not, Cale, let me turn to you, because as much as it's really important, and thanks again, Dario, for pointing out what the One Health Cross-Agency Task Force does, the broader public is most probably not aware of the fact that these mechanisms exist. Is probably not aware of Horizon Europe programs, where indeed the focus of all of this is being studied. And at the beginning, you spoke about the social buy-in, and indeed, I think we know since, what is it, 1915-7, when the Club of Rome presented their findings, that yes, climate change is an issue, and we're only slowly, and I think you pointed it out very well, Roser, due to the political context and rising populism that we're facing these days, coming to the acknowledgement that yes, we have to deal with climate change, and it's an immediate priority. It must be an immediate priority. So when we speak about the social buy-in, is there anything that perhaps is not part of the paper and that you feel is crucial in getting that buy-in?
Thanks for that. Good question. I think your paper very well covers quite a lot of aspects, and I think what we've talked about here and the paper in together really do illustrate quite well what we need. I think that, yeah, I think buy-in is multifactorial. I think the data point we've all elaborated on is quite an important piece. I really liked, Rosa, how you mentioned the pandemic, because I remember seeing during the pandemic that, you know, the prevention side of funding and data before the pandemic was there, but, you know, general people and politicians and even a lot of health experts didn't really give it the priority that it needed. And then during the pandemic, at some point, I remember reading that the cost of prevention would have been 20 billion or something per year, and the cost of the pandemic to that stage had been 3 trillion or something globally. So I think having that data, but also having very relevant, up-to-date data is very important, because people sort of think that planetary health crisis and climate change is something that's kind of in the future. It's just around the corner. It's getting close. But it isn't. It's happening now. And, you know, when we see floods and fires and all sorts of horrible things happening around the world, we do need to realize that these are the climate unraveling. The World Weather Attribution Service has talked about the wildfires in Canada being, I think it was about 7 times more likely because of climate change, and the drought in the Horn of Africa being about 100 times more likely because of climate change. So we need to highlight that these things are happening now. And I think the Horizon Project's really great in that there is recently a funding call for planetary health, which looks to bring in a lot of these different pieces of data across different sectors and agriculture. And I really appreciate Dario as well mentioning forestry. I think, this data around how these natural systems that we all kind of know work towards our health, but that rigid data that says, yes, they do benefit our health. And again, Lati as well. And I think what you've proved about the immune system function there is also really important. So having, like, I know you've talked about data, but I think as all of us need to have this very recent, up-to-date, sellable data, not historic data, but like proof this is happening now. I think part of how we can do that is to also take into account all of society, because the most marginalized and the most vulnerable are the people who aren't the loudest. So, you know, having these voices, promoting voices of people who are on the fringes of society, and also having them involved in the policy-making process is going to form effective policies, but also show everyone the current state of affairs, because, you know, how well do any of us know about the state of Roma people in Romania and what the environmental pollution they're facing? I think people only specialized in that field do, but those things are relevant to all of us. They affect all of us in one way or another. I think that I liked as well, you've talked about leaders, and we've all talked about leadership, and I've very much looked towards Lati for a while on how leadership can happen and how these stories can be sold. And I think as well, during the pandemic, we saw the Team Europe approach be quite effective for preventing health harm, because if we didn't have leadership during the pandemic, it would have been chaos.
Yeah, thank you. Maybe I just use the opportunity to advertise also for a conference that will be organized in Lahti next year. So it will be an international planetary health conference taking place in February in Lahti. I can send you the exact dates if they are now being confirmed, or you can then pass through to everyone who is interested. But maybe just I mentioned also one study, because talked previously what motivates the decision makers and often from the economic perspective, but then we actually did a survey in Sitra, what motivates people to take nature into consideration. And we were actually surprised. Over 2,000 people answered to this survey, and they said that most important for them was to have health benefits. So it's really untapped potential, and we could use this approach more because people are really interested. And the second one that was most important was that they see health and environment are connected. And the third one was the intergenerational aspects, the right for the future generation. There was also an option for the bringing economic benefits for the people, but this was not so interesting.
Yes, Rosa.
I mean, because my colleagues here, well, all of them made very, very interesting comments, and I had comments on their comments. And maybe on Dario, on the task force, and it's true, it is working well, and we are trying to work with them. He said something very important, strategic coordination and policy support. But basically what the agencies do, as he very well explained, is scientific advice and is risk assessment. The problem comes with the risk management, the policy action. So you assess, and surely it's going to be complex because of the data, because of, and by the way, talking about data, I'm not sure that anyone mentioned artificial intelligence, which is today so trendy, and I'm sure it will help a lot in the area of One Health. But one of the challenges always that we have also in current areas, in food safety, in many areas, is precisely the risk management. You assess about pesticides and I think that Dario himself referred to the legislations on sustainable use of pesticides and others coming, hopefully coming, because member states are making things extremely difficult. So when it comes to the risk management and to the policy response, then things get very complicated. On Elina, she mentioned the Lathy example, extremely interesting, and obviously, and the reference to urbanization. And in a recent discussion that we had, because we're also organizing a conference, which I will promote. On the 13th of November, you will see it announced in Luxembourg. It's a One Health conference. And among others, Mario Monti will intervene. And in a discussion with Mario Monti and other people, who actually, they were saying One Health should go far beyond the triangle that we now see with the human health, animal health, and environment. It should cover so many areas, including architecture, including, and it's true in the end, but that makes it very attractive, very logic, at the same time, even more complex. And so once again, we were saying, yeah, but please, don't put everything together, because we will never be able to propose something, practical. And that my obsession is to be able to, not only to demonstrate the added value, is to demonstrate that what we propose really has that added value. Just wanted to make these little comments on the very interesting comments of all of you. Thanks.
No, absolutely. I think to perhaps put it into an even more challenging perspective, indeed, it needs to go beyond the triangle, as you say. But during the conversation, we're touching on a lot of also social determinants, food safety, forestry, and we have been speaking indeed about all these challenges at EU level. But clearly, and I think you hinted to it earlier as well, as we speak indeed in New York, the Sustainable Development Goals are being discussed. And it's a very important moment in time, the year 2023, because we're halfway through. And we have seen in another project that Danielle and I have been working on, which is about HIV, that indeed only for this area, where indeed it's one of the Sustainable Development Goals to eradicate HIV by 2030, we're lagging behind. There's European member states are really lagging behind, but let alone when we speak about it at a global scale. And one of the recommendations of the paper indeed go also into strategic partnerships at global level. And it's true that indeed the pandemic treaty is being negotiated. But without sounding cynical, the last time that I heard about the latest play of the negotiations, it was all about looking for the lowest common denominator, because otherwise at a global level, there would never be agreement. So when we speak indeed about what can the EU do, now we have, of course, the global health strategy. What is there that we can do more, and what does the global health strategy make for a difference?
Well, the global health strategy is really all about One Health. And we are trying, and you mentioned the pandemic agreement, and here we are finding two main, I would say, from the Commission perspective, two main challenges. One challenge is the how would I say, the different balance in the world order and the global South weight in the pandemic with their own interests and the fact that they have another perspective, and true also that the pandemic agreement was not put forward or organized in a very easy way for discussion, so it took a long time to start. The other element for the Commission is also, once again, it's a competence issue. When the same way that when in the middle of the pandemic, everyone wanted legislation and coordination and everything, we proposed the legislation, and when it came to the negotiation, member states came back. So they, well, maybe not that. So, and you referred to Team Europe, and it's true, there's a lot of Team Europe collaboration. But let's not forget, member states, they want to be seen also individually as in their own, I would say, we were talking about, what was that, vaccine diplomacy at a certain point in the, again, we want to work together, we do work together, but we still have, including in the context of the negotiations, when we were going to present declarations at UNGA, precisely, again, we had sometimes some reticences from certain member states on, so even that sometimes becomes a problem in terms of EU coherence or unity. So yeah, we're not yet there. We hope we will get the pandemic agreement, but we're not yet there.
Well, I think also coming to a point where I'm interested in your sort of last remarks, your closing remarks, if you wish, also by the way forward, because I think it really comes back to, indeed, the need for a more holistic approach also links very much to the position of Europe in the world, where we speak a lot about open strategic autonomy, the EU's competitiveness, the fact indeed that when it comes to green agenda, we also need to ensure that this is a holistic approach that also applies to a lot of different areas where it's all part of the same story. I mean, the EU cannot be competitive if it hasn't also green instruments at its disposal, like green procurement, for example, as is mentioned in the report. And where, again, it's also very much about the data agenda, where indeed also the EU needs to have this approach and different data spaces. So with that in mind, I would like to ask you for your closing remarks. And Dario, I know that you need to leave a bit earlier, so let me perhaps start with you for your closing remarks.
Yes, and I thank you very much for your understanding. I will I mean, I don't want to make like an overarching kind of, you know, closing remark. I think we've touched all with together with the other speakers on you know, many important aspects. I wanted to maybe address one point that I also wanted to say before, and I think it links to some of the things that you just said, which is the data point, because one way, and I'll touch about it in two ways. One way is relating to the work of the agencies. And the fact that this was also part of the background paper, by the way, you know, how can we increase data availability and the availability of indicators to measure planetary health? And I think there one important aspect is that, I mean, I think we have a lot of indicators in the work that we do to monitor the achievement of the strategies under the Green Deal. I think what is really important is the narrative and around those indicators and how we put these indicators in relation to clear prevention and precautionary objectives for the EU. The other aspect is, though, that I think we should recognize that when we talk about the issue of data availability is that we have, for example, on the environment side, I mean, we are collecting a lot of data. We were actually expanding our data capacity because with new policy proposals, whether it's on, you know, restoration, whether it's the updates, hopefully to the Water Framework Directive, we will be in the position to collect more data about contaminants in the environment, for example, that we would put to the service of One Health. But where we often are missing data is actually on the health side, right? Because we don't have good EU-wide health data that we can use as agencies. And that relates pretty much to the importance of really trying to find innovative ways to share data across countries so that we can use those data sets in connection with environmental data sets. That is what really can make a difference. One thing that we at the agency we wanted to do and we're starting to do is to, for example, use our land use change data and land cover data that we have as part of our Copernicus land monitoring service to study, of course, the relationship with health outcomes in Europe in relation, for example, to green spaces, in relation to the quality of green spaces, their accessibility and so on. But we don't have, of course, EU-wide data that we can use to do that assessment. So that's pretty much a call for, you know, increasing the availability of data and data sharing on those premises. The other thing, the final thing, it is also about data and indicators, but it's about the external dimension that Jose was talking about and that you, Elizabeth, mentioned, which is, I think, one way in which the EU can exercise also leadership is to really trying to push for that increase in data availability at the global level as well. I think I've seen that by being part of some discussions on the post-2020 framework of the Convention on Biological Diversity, where the European Commission, specifically DG Environment, was pushing a lot for the adoption of ambitious indicators, for example, in relation to pesticides under the Global Biodiversity Framework. And now it's working together with, of course, the various working groups under the Convention on Biological Diversity to develop a monitoring framework that, of course, taking into account differences in data availability between the EU and other countries, but still can help us achieve a broader picture, obtain a broader picture of what's happening across the world, which is pretty much in line with the concept of planetary health, right? We cannot hope that we can do our assessments only when the quality of data is good at the EU level, and then we don't have the same quality beyond the EU borders on some of these drivers and pressures.
Well, thanks so much, Dario. And since you need to leave, let me already thank you for your contribution. It's much appreciated, and you brought in a lot of important elements. And it's really good to know that indeed there is interagency work, that European Environment Agency is very dedicated and committed indeed to keep working on the topic and also driving the notion of prevention within the institutions. So it's great to have seen you again. Many thanks for your contribution, and I hope we stay in touch on this important topic.
We will. Thank you very much for your understanding and for having me. Have a nice rest of the conversation.
Cale, let me turn to you because, again, having listened to the conversation about the way forward, is there anything that you feel we should still take into account?
There is one major thing. It's mentioned in the paper, and I referred to it quickly before. And I think a lot of us in society are generally tiptoeing around it, but I think it's this, you know, when we pull back to look at why we're in this situation, we really need to kind of ask what systems are enabling this. And we do need to say that this constant drive for growth, consumption, and exploitation is behind all of this. When we're talking about why can't we, or why is it difficult to sell climate change or planetary health, it's because we're so used to a system of just comfort, convenience, and anything is possible and everything will come to us. I've got a quote here, which I thought was quite relevant from Yuval Noah Harari in Sapiens. I'm sure many of us have read that. To quote, we are constantly wreaking havoc on our fellow animals and on the surrounding ecosystem, seeking little more than our own comfort and amusement, yet never finding satisfaction. So I think it's a good point, because, you know, comfort and amusement is what we're so accustomed to. And if we're going to make the changes that we need to face climate change and to face these planetary health threats, it's going to need some discomfort. We're going to need to give up some of what we're so used to. And I think that, you know, the system change needs to happen now, because otherwise things will get much more uncomfortable. But I think that if we need to sell planetary health and facing climate change as the obvious easy choice to make this happen, to overcome things like ideology, like ideological splits within the EU, for example, but also globally. And we need to bring up everyone with us in that, because this kind of system of consumption and hyperdrive extraction is what's got us here, and it won't get us out of it, and it will only degrade it further and threaten us all, really. So economy of well-being is kind of how I'd bring that all together.
Well, thanks for that, Cale. And it very much links indeed to the work that we're doing here at the European Policy Centre on the economy of well-being, the notion of going beyond growth. So indeed, we have also been involved in the conference in May of MEP Lamberts in the European Parliament. And we also clearly hope, and that's also where indeed the recommendation on the Vice President for the Wellbeing Committee stems from, that indeed, even though we see the challenge, but, you know, as a think tank, we need to be ambitious. It's our mission and our duty, I feel, that we think about the longer term. So in that respect, we very much see your remarks in that broader vision, indeed. So Elina, having brought up the example of Lati and knowing the work and also the conference indeed going to take place next year, any last remarks from your side?
Thank you very much. Well, I just also want to highlight building this case for the planetary health and getting this political will and buy-in also from the general public. There is clear motivation that the general public has, that if they see that it's promoting their health, they're also more willing to do it. So it's positive. I think we have chances to get this right. But then really starting the action also now, not waiting also only the political will, but really starting the action already now. And starting building the national level roadmaps with a more concrete implementation plan across the different sectors, but also within the specific sectors and how they can integrate the planetary health approach or One Health approach. And then keeping this in mind with a clear vision, eyes on the sky, but also feet on the ground, being realistic about it, and also not thinking that someone else will do it. That is someone else's responsibility, but thinking what I can really do, what can the different organizations do. For example, when I started in Sitra 1 year ago, I moved from Sweden, I worked there at Karolinska and also at Stockholm University. But when I started at Sitra, my job didn't include anything on planetary health. I just started driving it. And here's what we see as a result, the paper and the roundtable and what we had. And we've been also promoting this issue in Sitra at the national level. So we are definitely getting more active in this area. So my message is that everyone can make a difference, and we should start now.
Well, thanks, Elina, for these inspiring words. And perhaps, Danielle, that brings me to you, because indeed, you know, change starts with ourselves, and especially in your role and with the paper that you have just written. What would be the next project that you would aim to work on, also take into account the discussion of today?
It's a big question. I think one of the things, and it's reflecting on what both Cale and Elina have said, is that this planetary health, of course, focuses on the interlinkage between policy areas with a particular focus on the planet and health. But as was mentioned earlier on, and reflecting on the conversation you had in light of your conference, it's much broader than that. And it's very hard to stop the links once you start making the links. So you say health's connected to the environment, but then environmental policy is related to industrial policy, transport policy, trade policy, all of these things. So I think we really need to continue to have these conversations to talk about how these things are connected and why they're important, moving away from our absolute emphasis on growth as well, while also taking that into consideration when we're having these conversations. We have to be realistic as well. So I think it's merging the two and having two, I suppose, strands at the same time of those ambitious conversations about long-term linkages, about a shift in how we think about how our systems operate, about how our societies operate, but at the same time starting these, like the Finnish example, smaller scale projects and pilots, so we can actually also advocate for and see where change can happen at the smaller scale. So I think kind of looking at how we can do the two at the one time, which is not necessarily an easy thing, but I think that would be where I think we should start looking at next.
Well, thanks, Danielle. That seems a very important mission for the EPC Social Europe and Wellbeing Programme, indeed. So, Rosa, the last word is for the Commission. We have spoken about a lot of dimensions. So what is perhaps the last remark, anything that we haven't discussed yet, or what is your vision for the next Commission?
Well, actually, I will not finish with a remark, but with a plea. So the next event that you organize should be with the policymakers. So those that will decide the next political priorities. I think that it would be good, and I hope that you don't invite my commissioner and then I end up coming because she cannot come, and because she has other but maybe it would be good to, from your side, to also put a bit of pressure on those, because we see that. I think that, I mean, I'm not gonna hurt. We've discussed so many things, and I think that we all agree. But maybe a bit of a push to those members of parliament who may have some strange ideas or no ideas. That's the problem, probably sometimes, and maybe some maybe future commissioner, or even vice president, who knows? That would be good. Thank you.
Well, thanks so much, Rosa. I think that's a great aspiration to end this discussion on, because indeed having perhaps the future vice president at a future event, I think that's something that we absolutely strive for. And I think it brings us, of course, at a very important point in time, and also a very important closing remark, which indeed is about a call for action. I think clearly this conversation showed that at a lot of different levels, we need action, of course, starting with ourselves as individuals, but clearly also at the national level, trying to elevate the examples such as Lati. Indeed, for Team Europe, there is a lot at stake. There's the narrative that, again, still needs to get buy-in. And I think we have seen that indeed also with the nature restoration law. We have indeed discussed it also with MEPs in the closed roundtables leading to this publication, that indeed some MEPs have no clue at all, to put it very frank. Others, and again, it comes from, I think, a good place, have been advocating for a SANTE committee in the European Parliament, which again in itself is important to mark the momentum for health. But to me personally, the fact that it wasn't really coming from a One Health approach already signaled the fact that it's a bit of a trap, that, MEPs also feel that they want to have their own committees, losing sometimes that bigger picture. Again, we have spoken about the need for more data, the data spaces, not just the health data space, but also the broader remarks, the social buy-in and the need for more communication, how challenging that may be at the European level, but clearly also the external dimension. And I think especially this event taking place in the context also of the UNGA now in New York, in the context of Sustainable Development Goals, shows you the immediate and the enormous challenges at stake. So I would like to thank all of you for your input. Greatly appreciated. Thanks for being with us this morning. And indeed, let's start this event with a call for action. And so I hope to see you. Hopefully, at some point in time, we'll come back and we re-evaluate where we're standing. Thank you very much also for attending this event. Have a good day.